are on a Wednesday morning. That means time for our weekly chat with Dr. Stan Anderson. Good morning, Dr. Stan.
Per hour, okay? But we're doing about 75.
Uh-oh. I think we got you. Are we there? Are you there, Dr. Stan?
Oh, yep. Can you hear me?
I got you now, yeah. We had a little bit of a reversal of something on our board. But we're good now. How are you today?
I am doing great. Thank you.
All right. So I feel like I age more and more every stinking minute of every day. Help me, Dr. Stan. Help me.
Yeah, it's kind of interesting. Aging is one of these things where our cells just don't they don't replicate as well. They don't fix themselves as well. The biggest thing when it talks to how do we find out how old someone is, not chronologically, but biologically, is to look at something called telomeres. Now, every DNA has an endpoint, and think of it as the shoelace. In your shoelace, you end up having kind of a plastic tip at the end, and that's how your shoelace knows that that's the end of the shoelace. Your DNA also has an end, and those are called telomeres. And you can actually determine how old someone is by measuring the length of their telomeres. Now, it's not something that's available as far as go to your doctor and have them run this test. You can't do that. It's a research test. They're doing it primarily to try to determine that. But there was a new study that was looking at what are the things that cause the telomere to be bigger and healthier and longer, and the number one vitamin that showed up was vitamin D. D as in dog. So vitamin D enhances telomere length, which we think, now this has only been shown in dogs and in rats, so it's never been studied in humans, but it's pretty safe to take some vitamin D. So the newer regimens are almost always going to include vitamin D because that might help to preserve your telomere, and you might live longer and you might recover better.
Wow. And vitamin D has other benefits too, correct?
Yeah, it's kind of interesting because you need it for a woman in menopause. You need it to try to help to protect your bones. Interesting data that people who end up developing multiple sclerosis, which is a neurodegenerating disease, that if they had almost always, they have very, very low vitamin D. So could it be that if we started to give everybody in their teens and 20s higher levels of vitamin D, could that potentially protect from ever developing multiple sclerosis? It's just kind of interesting. There's almost no downside. The downside to vitamin D is that if you get very high levels, that it can increase your risk for developing kidney stones. So you want to make sure that if you're taking vitamin D, talk to your primary care provider, consider getting a vitamin D level just to make sure that it's in the acceptable range, that you're not hurting yourself, but you're taking enough that you are helping yourself. This is not one of those more is better. You want to get into the normal range, and once you're there, it doesn't matter if you're at 30 or if you're at 80. Anything in the normal range is considered protective and healthy.
All right. So there are apparently some other things that we can do to slow aging. Like what? What could we do?
Yeah, this is kind of interesting. So anybody that wants to try to think about what can I do to maintain my memories, do whatever I can to maintain my sanity, maintain my health, try switching hands when you brush your teeth. So this is kind of interesting. When you do something different, you are training your neurons in your brain to do it in a different way. So the way to think of it is that if you do the exact same thing every single day with no changes, you get into this regimen, this routine, this pit, if you will, oftentimes that helps to create new neuron connections, and that helps people not to age as fast. And it's your outlook. So if you can think of some joyful memory right before you go to bed, that oftentimes has this huge, huge benefit. Getting out in nature. So what we know is that there is this hormone called forestin that when you're in the forest, forestin actually is increased, and it increases your anti-aging capabilities. So getting out into the forest, using your non-dominant hand to brush your teeth, ask yourself some new question daily, having some joyful memory, and then finally, deep breathing. There's good data that when you calm yourself with taking deep breathing, that has a huge benefit with helping to prevent aging.
And if you're going to brush your teeth with your non-dominant hand, just be prepared to have toothpaste on your face. Right?
Yeah, part of it is just getting out of your routine.
Yeah.
Doing something that is not what you would normally do, that is what is going to challenge your brain, and it is going to help you to live better and to live longer. And what's interesting is the people that are the happiest, people that overall they say their joy, their enjoyment of life, it's not in your teens or 20s or 30s, it's in your 70s.
Wow.
So the older we get enough experiences of life. We have enough that we've saved. We have enough that we've been through. We don't have to prove anything to anyone. It is that aging and in the 70s, that's when we tend to be the happiest.
Well, I have something to look forward to, see? There we go. We're good.
So, and exercising. What's
Yes.
interesting is people that exercise end up having better fitness, but also new study just came out on Monday. It enhances cancer survival. So people with colon cancer, one of the things is we do chemotherapy, we do surgery, and the problem is there's never been a study that ever looked at does exercise enhance people's survival, and the answer is yes. By far, doing exercise of any kind, you have better cancer survival. People that exercise live longer, and it helps their brain to function better. And then the final thing that's kind of interesting, this is a study that was done where they were looking at people who developed Alzheimer's, and they found that there was a huge correlation with cold sores, canker sores in and around the mouth. That the more canker sores, the more cold sores that you've had, the more likely it is that you're going to develop Alzheimer's disease. And that leads credence to the whole idea that maybe getting the shingles vaccine, which raises your immunity towards the cold sores, the HSV, that if you do that, that gives you protection from ever developing Alzheimer's disease. So everything kind of fits together. The more calm you are, the better you're going to do. The more joyful you are, the better you're going to do. The more fit you are, the better you're going to do. The more that you are challenging yourself, learning new things, asking yourself questions, spending time in nature, getting out of your routine, you're going to live longer. So all of these, just new things that people should consider, and it's something that will help you to feel better and live longer.
See, I feel like you're a coach in a locker room. You just gave us that pep talk. I'm ready to go, Dr. Stan. We're going to exercise. We're going to take our vitamin D. We're going to brush our teeth with the wrong hand. All those things. Well, you have a great week, and we'll chat next Wednesday, sir.
Oh, thanks, Pam. I look forward to it.
Canton's Morning News with Pam Cook.
If you missed one of our guests, get the podcast now or anytime.